Thank you again for joining us for Retention Planning, Build It and They Will Stay, Part 1. Your speakers today are myself, Helen Ray Vernier, and Mandy Gingras. Mandy is the Director of Education for 3RNet, the National Rural Recruitment and Retention Network. The 3RNet is a nonprofit organization and trusted resource for health professionals seeking careers in rural and underserved communities. And Mandy provides recruitment and retention educational support to 3RNet members and safety net facilities across the nation. And we'll learn more about 3RNet from Mandy in just a moment. You probably know this since you're on an ACU webinar, but we are the Association of Clinicians for the Underserved. ACU it was started a little over 25 years ago by alumni of the National Health Service Corps. And while we've changed a bit over the years, our focus really does remain the same, and that is to improve the health of America's underserved populations and support the clinicians serving in those areas. And so to that end, the recruitment and retention of a transdisciplinary team is the road to achieving those goals. I'm here today on behalf of the STAR Center, which stands for Solutions, Training, and Assistance for Recruitment and Retention. And we are a program of ACU that's funded by a national cooperative agreement by the Bureau of Primary Health Care. We're one of 22 National Training and Technical Assistance Partners, or NTAPs, and each of us have a different focus or niche area, and ours is the Health Center, Workforce Recruitment and Retention. We started a little over a decade ago, and since then we've been producing free resources, training, and technical assistance. The website for the STAR Center is listed here, chcworkforce.org, and that is separate from the larger ACU website, just because we want you to know that when you're there, everything is free and available to you as health centers and primary care associations. So now we'll learn a little bit more about 3RNet from Mandy.
Thank you so much. It's a pleasure to be here, everyone. Thank you for having me, and I'm looking forward to co-presenting with Helen today. For those of you that aren't familiar with 3RNet, as Helen mentioned, we are a nonprofit organization. We are federally funded through the Federal Office of Rural Health Policy. We are a member association. We were established in 1995, and it is our mission to improve rural and underserved communities' access to quality health care through effective recruitment and retention. So we are an organization that focuses on the unique needs of rural and underserved communities. We're most well known for our job board, where we work to connect mission-minded and passionate health professionals with some of the really most unique and really rewarding jobs that are located in some of the most diverse rural places across the United States, and also in urban underserved areas as well. And the safety net facilities that we represent are the places where health professional services are really most needed to care for those underrepresented and disadvantaged populations. I do have a couple of links on this slide for all of you so that you know how to find our website at 3rnet.org. We are also known for our network coordinators. We have a network coordinator in every single state that represents 3RNet in that state. So there is a link in the pink box for you so you can find who your network coordinator is. The network coordinators can help facilitate the job board in the state. They can provide you to resources on loan repayment, incentive programs, also the J-1 visa waiver programs in your state. And we also provide plus tools that were designed for rural and underserved safety net facilities in mind, where you can really simplify some of your recruitment efforts through some of those tools. We also provide education. We have a ton of free resources on our website. It is free to register on our website, and I provided a link so that you can find that link there, and you can go to once you register, you'll have access to our dashboard, and that is where you can find all of our free resources. And we're actually going to go through a couple of the resources today so that you know what they are and where to find them. And I will turn it back over to Helen now.
Awesome. Thank you so much. So this is a two-part webinar series. Today is, of course, May 22nd. And in this section, we'll be focusing on JEDI, Justice, Equity, Diversity, and Inclusion, retention through the employee life cycle, onboarding, mission and culture, and compensation and benefits. And then the next session will take place on June 12th. And during that session, we'll focus on work schedules, career paths, employee engagement, and some rural focus strategies. So our learning objectives for today are to equip organizational leaders with the tools and insights necessary to proactively address retention pitfalls, nurturing a supportive and fulfilling work environment, and ultimately cultivating a resilient and cohesive healthcare team. Learn how to customize retention plans to suit the unique needs and challenges of your health center, incorporating adaptable strategies that resonate with diverse staff demographics and organizational dynamics. Explore the recruiting for retention guiding principles and identify retention best practices that foster a positive culture and keep your staff engaged, satisfied, and fulfilled at your health center. So with all these in mind, we'll get started on the content in just a moment, but I do want to highlight that Mandy and I will be keeping an eye on the chat, so feel free to ask questions throughout if anything comes up, share your experiences, any wisdom you'd like to share with your peers, etc. As with every webinar, the slides and recording will be shared as soon as they are available to us, as soon as Zoom is done processing them, and they'll be shared with all registrants. So whether you are in attendance today or have just registered, we'll make sure to get those to your inbox, and then you're welcome to forward and share those with anyone you think would be interested. So with that in mind, let's get going. Let's talk about retention. At the STAR Center, we really do believe that workforce is the fuel for your organizational operational efforts. And we think that a health center with a full tank of workforce fuel identifies workforce as an essential organizational issue and invests in appropriate operational and staffing resources, and then has some key features. And they may look different at every health center, but these key features or core components remain the same. They're listed here, and of course, they're all inextricably linked, and they all support each other. But today, our main focus really is the tested, in this case, retention strategies. These should go into your data-informed workforce plan, and of course, they then help create all of the, a positive culture focused on engagement and equitable and effective compensation structure, et cetera. Again, they're all sort of tied and inextricably linked, but that's our focus for today. So when we're talking about justice, equity, diversity, inclusion, we know that these terms can mean different things to different people and that they all have very important weight. And I'm not going to read each of these out to you, but it is just important to have some grounding definitions. And we want this to be a resource for you as you're looking to embed JEDI, justice, equity, diversity, and inclusion into your health center retention operations. And so as you are doing that, you can revisit these. And again, the slides will be available. So we want this to be a tool for you. It's important to be thoughtful too about why does this matter? Why are we doing this? And of course, there's the idea that it's just the right thing to do, which I think is a valid enough reason, but that's not always as convincing as we would like it to be. So when we execute JEDI programs effectively, people feel like they belong at work. And when people feel like they belong at work, they're 3 times more likely to feel or to look forward to coming to work. They're 3 times more likely to say their workplace is fun. They're 9 times more likely to believe people are treated fairly regardless of their race. And they're 5 times more likely to want to stay at their company a long time. So when we invest thoroughly in justice, equity, diversity, inclusion, we are actually increasing the longevity and that retention of our workforce staff. There is, throughout the presentation, we'll be sort of highlighting some resources. So the STAR Center, in conjunction with ABCHO and the National Healthcare for the Homeless Council, created this toolkit to help folks build an inclusive organization. So you can access it now through the QR code, or of course, when you get the slides, there are direct links in there. And when we're talking about all this, about including justice, equity, diversity, and inclusion, when we're talking about it within retention, I will weave it through, but essentially we're just asking you to apply that lens, apply the Jedi lens. And a lens is simply a framework to guide our decision-making policies, procedures, programs, or decisions that are being considered. So as you're reviewing and viewing your retention policies and strategies, we just want you to put on those Jedi glasses and be thoughtful about how we can be more just, equitable, diverse, and inclusive. So with that, I'll pass it to Mandy.
So one of the or some of the guiding principles that 3RNet believes in is retention for the employee life cycle. And some of the key strategies or tools to help you do that are listed here, from onboarding, doing engagement or satisfaction surveys, stay interviews, career ladders, succession planning, work-life balance, compensation surveys, and also utilizing total compensation statements. We're going to go through several of these tools today and also in our next session to help you understand how best to use these and how you can really engage and utilize these as retention tools. But in a nutshell, all of these are really great ways for you to learn more about your employees, learn how they're feeling, identify any problems before they become too big of an issue to resolve. They also give you a really cohesive way to show how your organization values and appreciates, and to show that you care about your employees. They're all engagement strategies, and they're ways that you can really use to keep your current employees happy. And then in return, minimizing their consideration of looking at other job opportunities. It's also a great way to have a supportive leadership. We know that good leaders and good communication is what equals successful retention. So equipping your leaders to be the best that they can, and making sure you're creating a culture where communication is utilized and people aren't afraid to speak up and they feel that they have a voice. This is the type of organization or type of culture within an organization where you're going to have more successful retention. So these tools are designed to help you get there. And I'll turn that back over to Helen.
Nice. I think Mandy's already, we've already given you a good case on why retention matters, and hopefully you're here because you already see the value of retention and retention planning. But again, in case you need convincing, or if you need to convince someone, doing retention planning and programming reduces cost. We know that turnover is expensive, so recruiting and onboarding new hires is time consuming and especially detrimental when paired with severance costs. And so we're saving our organization time and money with a solid retention strategy. It improves morale. When valued employees leave, it can be a real downer for the team. Effective retention strategies can really boost morale. And when morale is high, the workplace becomes a more positive place. It's this iterative process where things get better and better. Productivity is increased. Productivity and engagement tend to be higher among tenured employees. Those long-term folks have had time to develop their abilities. They can accomplish tasks within a shorter amount of time and are more committed to the success of the organization. And research also shows that high engagement levels lead to increased productivity and better quality of work. And so when we focus on engagement and retention, employees tend to notice and they perform better. And in our line of work, that performance means higher quality metrics and better patient care, which is what we're all here for. That leads into the next piece around improved patient experience. So if we're focusing on retention, that can make employees happy, and employees who are happy exude that feeling to patients, and employee happiness relates with high engagement, and high engagement leads to better service. Plus, employees who've been at their organization long-term can solve those complicated problems and boost patient satisfaction. Again, back to that culture piece, your organizational culture affects whether your employees leave or stay. And so if you experience high retention rates, you can thank some of your culture initiatives. In fact, 72% of workers cited workplace culture as a driving factor in whether they work at a company or not. And so when you're able to engage and retain your folks, they'll feel more connected to their work, their team, and your organization. We've already touched on this, but it also improves employee engagement. Research shows that there's a direct link between employee engagement and retention. So employees who are highly engaged are 1.8 times more likely to say that they'll be working at their current organization a year from now. So it's no surprise that organizations who prioritize retention efforts have those highly engaged employees, and people are more satisfied, and have lower absenteeism, and higher engagement when they are being retained. So there are various pieces of retention planning. And of course, the best strategy to minimize those recruitment problems is to retain your providers and other staff in the long run. And so when we understand these retention issues, it can really help our health centers focus on candidates who might best add value to our health centers and our health center culture and environment. And this is a key point to emphasize when we're talking about why retention matters and how we can to build that support for that within our organization. So we're going to go through each of them throughout this two-part series, but these are the key elements. We do, again, want to highlight a couple of resources here. This is the Health Center Comprehensive Workforce Plan. It has different sections, including a retention section that touches on each of these different key areas. So again, you can utilize the QR code to grab that now, or get the link when you get the slides. And then I'll let Mandy explain this next resource.
Yes, sure. This is the 3RNet's Recruiting for Retention Guidebook. We have divided up the guidebook into 4 parts. So part 1 covers planning and preparation, everything from creating that recruitment budget to assembling your recruitment team and preparing your recruitment team as well. Part 2 focuses on marketing to and finding health professionals. So that's your sourcing, your advertising, your messaging, how to attract candidates, and how to entice them to apply for your jobs. And then part 3 covers the matching and committing, which is everything from screening candidates all the way to negotiating a contract. And then part 4 is where we are today, which is retention and retaining for the life cycle of the employee. So we are going to be focusing. I do have a direct link here. There's a link, but also the QR code will take you to part 4, which is also located on the dashboard too.
Thanks.
And I'll turn over to Helen.
Great. So first we'll talk about onboarding as promised in our little agenda. When we talk about onboarding, we think of it as this vital link between recruitment and retention, providing new employees with the necessary tools, information, and support to really smoothly transition into their new roles. And so this can really help foster a sense of belonging and engagement from the outset. And of course, you can think of every single piece of your recruitment efforts as part of retention, but onboarding is really where you cross that bridge into from trying to get someone in to trying to keep someone at your organization. And a well-executed onboarding process not only sets the stage for initial success, but it also really lays the foundation for long-term commitment and satisfaction within the organization, ultimately contributing to those higher retention rates, which is the whole goal. We do also, of course, want to be really clear that orientation is not onboarding. They're not the same thing. For new hires, orientation is that one-time event, or maybe a couple of events throughout the first week that welcomes folks to your organization, whereas onboarding is a series of events that includes orientation. So we're not saying orientation isn't important. It is. It's just not the whole package of what we should be doing to successfully integrate someone into our organization. And onboarding really helps folks understand how to be successful in their day-to-day job and how their work contributes to the overall organization. And it is that really longer process where it can't be boiled down into just simply a checklist. You're going to think it's funny that I said that when I go to the next slide, whereas onboarding is more of a strategic plan. That being said, more resources. The STAR Center does have an onboarding checklist. This is still a strategic way to think about how you're onboarding, and it's written as a Word document, so you can look at it and edit it and add to it as you would like to for what makes sense for your organization. But it's just sort of a nice starting point for people as you're working on creating or updating onboarding policies and procedures. So like I already said, onboarding should be that entire process. And the end result should really be having someone become fully part of your health center's culture. And that's not to say having someone assimilate into your organizational culture, but instead to feel and to be included and to be part of the organization. It's about also, especially as health centers, it's about onboarding them beyond just into your organization, but into your communities as well. So this is sort of the process. You have that orientation piece that we already talked about. You set those you set those expectations and let folks know what's expected of them and what they can expect from you, which can help build that trust. And then the integration is having them be part of the organization and the community. You bring them into all aspects of those pieces, and that's where that culture comes from last, is from building out those pieces, that trust, that integration, and they actually become part of the culture. As I already mentioned, we really want to be careful about integration without assimilation. When you're bringing someone into your organization, you're doing so because you chose them. They bring value to your organization, and you want to make sure that that value is seen and that you are recognizing that and showing them that, so that they also feel that sense of belonging rather than a sense that they need to change who they are. So some examples of assimilation are rigid expectations about how professionalism is designed. So we've seen this through certain expectations around hairstyles or tattoos, or the way people speak even. Again, hiring for culture fit as opposed to culture add, having those ideas or that culture of that's how we've always done things, or this isn't how we do things there, instead of having a culture that's open to feedback and the perspectives of those new hires. When we reward conformity, that's an example of assimilation. And then avoiding conflict. When we have an open environment where diversity is truly valued, some conflict may come from that. And instead of avoiding conflict, if we have an organization that manages conflict, that can lead to better integration rather than assimilation. It's also critical that we are as communicative as possible, and building trust through communication can be a really powerful way to do that. So when we're building that trust, we should be strengths-based and empathetic, and we should be opening bi-directional modes for communication. These can include, like the slide says, continue listening sessions, stay interviews, formal and informal recognition, but it can also be through emails, staff meetings, posting in a staff lounge, those employee engagement surveys, feedback cards, intranet. And this is how we can be really thoughtful about and intentional about how we're making sure that we are both giving and receiving feedback in an empathetic way and in a way that helps that new hire, again, get up to speed and feel like they belong and feel like they're making a difference as quickly as possible. Again, if we haven't convinced you already, we think that onboarding is really important. It can help integrate new employees into your organization. It sets those clear expectations. It makes productivity occur more quickly, and then it reduces turnover. And as we've already talked about, turnover can end up being really expensive. And so when we invest in retention, we're actually saving ourselves money. So again, I won't read through each of these, but we do like for our slides to be a resource for folks. So this is a list of questions to ask yourself as you're building out your onboarding plan. So please review this while you're looking through things. We also encourage folks to operate from the 4 C's of onboarding. So there's compliance, which of course is critical to teach those basic legal and policy rules and regulations. Clarification, where there's that open communication around expectations both ways, who does what their responsibilities are, et cetera. Sharing culture, your vision, mission, values, but also how how that really takes place throughout every day, and connection, interpersonal relationships, community, and connection beyond that. This is just a list of some tips for onboarding and some of our favorite ones. Again, I won't read through all of it, but some of our favorite ones are to assign a mentor to orient the new staff member or to be part of that onboarding process. So someone who's not necessarily their manager or supervisor in any way, but more of a peer who can really be helpful and be that person that you can go ask a question to that you might not feel comfortable asking a supervisor. Of course, we should develop relationships where we can ask our managers and supervisors anything, but sometimes it's nice just to have a peer to even just to know you have someone to have lunch with those first few days, etc. Making sure that we're being thoughtful about the timeline for onboarding activities is really valuable, and providing different resources for their different onboarding tasks. Of course, as mentioned, we're going to always talk about JEDI. So as you're onboarding someone, discuss with those new hires what JEDI means in your organization, how that lens is applied, and how you really live those values. You should also create a separate specific JEDI-oriented onboarding session. Make sure that we're training our managers to lead in this space, and making sure that we're coaching existing staff on how to be a welcoming and embracing environment to support those new hires, and make sure that we're sharing what different kinds of resources internally and externally there are in our community for folks across different identities and backgrounds. Also, we want to be thoughtful about making our onboarding warm. Oh, sorry, that's too fast. Making our onboarding warm and thoughtful, again, about cultural gaps. A good example of this is if you're onboarding someone who you know is celebrating Ramadan and it's during Ramadan, maybe you don't schedule a bunch of lunches for them. So thinking about the cultural implications of various onboarding practices and making sure that we're continuously checking in with folks throughout the onboarding process, which can take up to a year. And then again, making sure that we're communicating throughout our organization that inclusivity and that culture that is welcoming and encourages belonging is everyone's responsibility. It doesn't just land in one person's department. Mandy, back to you.
Thank you. I wanted to point out just a couple of things, again, going back to kind of those core guiding principles that 3RNet follows. And there's a bunch of statistics here. There's a ton of studies on onboarding and why it's successful and how successful it can be. I won't read through all of those, but the most important one to me is this top one. 90% of employees decide whether they're going to stay or go within the first 6 months. So that means that your onboarding is crucial. That first 6 months of any new hires position in your organization is critical. So you can't make mistakes. You have to get it right. That 90% is huge. That's such a critical number. So I always like to start out by saying, make sure that you prepare for a really good first impression. And the best way to do that is to plan ahead. And what I always like to share with people is to make sure that you are easing all of those first day anxieties in advance. Don't wait until the first day to let them know about the dress code or the start time. All of these things are things that would be helpful for them to know in advance, just to kind of set them at ease and make them feel comfortable when they arrive on that first day, because we've all had first days on the jobs where there's a lot of uncertainties. Maybe you don't know if there's a kitchen or a microwave, so you don't really know, should I pack a lunch? Is there a restaurant nearby? What's the expectation around that? So just letting them know, setting out a plan. You can send out an email with a list of, kind of all of your logistics for day one, what time to arrive, who they're going to meet with, where they can park, what entrance they should use. Share what your dress code is. My son started a job not that long ago, and he happened to go for his interview on a casual day. And then, but no one said we have casual days on Friday. So he just assumed, oh, so I don't have to wear a suit. I can wear just a dress slacks and a shirt and tie, and that's considered appropriate. He shows up for his first day of work on a regular work day, and to his big surprise is, oh, no one pointed out to you that our dress code is a suit. You need to be wearing a suit jacket. So you just want to make sure that you're making them feel comfortable before they show up. You just want to prevent any of those awkward things that could happen. And one thing I should point out, with your internet, we talk a lot about a buddy and a mentor. And Helen had mentioned a mentor is kind of a colleague or someone to kind of help them get acclimated into the culture of the organization. For the new hires, we call that a buddy at 3RNet. And then the mentor would be more like their colleague that they're working with, who is going to be teaching them the day-to-day nuances about the position. And then that buddy is that friend at work. We really think that that's so important to really get them integrated into the culture of your organization. You know, like Helen said, letting them know about the cultural and the social activities, and making sure that they have friends at work from day one, someone that they have readily available to have lunch with them and to introduce them to other people within the organization. So it's that kind of that social connection within the organization. And then make sure that your new hire team is having regular check-ins so that you can make sure that your coaching and your support is meeting all of the expectations of the new hire, but also it's meeting all of the expectations for you, the organization, to help them get onboarded in up to speed as quickly as possible. And then also make sure that you are measuring your onboarding success. And you want to, continually measure it. Onboarding can last anywhere from 3 to 12 months, really depending on the position, but also depending on the person. And that is what really cultivates that long-term relationship building, and as well as gives them access to information. So the amount of time is going to fluctuate depending, like I said, either the position or the person. So making sure that to measure your onboarding, you can survey your new hires on their job satisfaction, maybe 1 month in or 3 months into the job. You can track how long it takes for your new hires to get up to productivity. You can monitor the new employees' overall morale at different intervals. Also track your employee turnover. That can be really, really telling, and maybe can point out some areas where you might need maybe some more leadership development. And make sure that you're monitoring your hiring manager's performance as well, because again, that if you aren't equipping your leaders to be strong managers and to be good communicators, it could really affect your turnover, because you might your onboarding processes might struggle a little bit. And then you can also use a lot of technology to help you streamline the onboarding process, from streamlining your paperwork and automating a lot of those manual processes, and also track your metrics through some onboarding technology as well. And you can do anything from having all of your paperwork electronically so that new hires can sign things electronically. You can have personalized welcome emails that automatically get sent out, checklists, welcome packets. You can do a lot of that online, same with all of your policy training. And then you can automate those deadline reminders as well. And then also track the professional development. That's another thing that you can do electronically. And one thing you don't want to forget, another statistic I want to point out, is the last statistic here. 78% of remote employees feel that their training was insufficient. You don't want to forget about your remote employees. Make sure that you establish an onboarding plan that's specific to your remote or your hybrid employees who are working part of their days away from the office. You want to make sure you're providing just as much training and support to those remote or hybrid employees. Make sure you have clear, measurable KPIs and expectations. Have regular check-ins so that you can sense and gauge how well they are doing. Make sure you're fostering trust and creating a sense of community. Belonging and strengthening that company culture are much more difficult to do, and so they have to be more intentional for your remote staff to make sure that they feel connected, they feel included, and they also feel like they have a voice at the table. And I'll turn it back over to Helen from there.
Awesome. Thank you so much. So many best practices. So next we'll focus on mission and culture. This is part of that, how we're building out those engaged employees. And a positive culture focused on engagement focuses on a culture of two-way communication to really continually improve the practice experience, reduce burnout, and support transdisciplinary teams in a consistent way. And health centers have this beautiful benefit that we already work in places with incredible missions, and we don't have to convince someone that working at a tech startup is somehow mission driven. It might be. Lots of tech startups are mission driven, but we don't have to work very hard to get there. And when we look at retention and those key areas, that mission piece is, like I said, it's baked into the organization, but it's really important too to make sure that it's clearly spelled out and that you're consistently pointing to it and looking at it, and that your staff are in line with that mission, and what you do, the services you give to your patients and your workforce really fit into that mission. At the STAR Center, we talk a lot about turning your mission inward and thinking about the ways that you're serving your community and including your workforce as part of that community. It's also important to note that 67% of millennials are engaged at work when they strongly agree that the mission or purpose of their company makes them feel their job is important. And when I say that, sometimes people are like, pshaw, millennials. But A, millennials have been in the workforce for a long time now. And B, within the next couple of years, millennials and Gen Z will be 75% of the workforce. And so thinking about and meeting their needs, including in this mission piece, is really important. And again, we have the benefit as health centers of coming from a really strong movement and legacy, and we just need to do an even better job of pointing to it and making people feel and see how their everyday work is part of that mission. And so with those mission-driven folks, organizations get major performance gains, increased loyalty and retention, greater customer engagement, improved strategic alignment, and enhanced clarity about work priorities. So we have this privilege already there. We just need to utilize it even more than we already do. So some ideas for including that mission within your organization and really bringing it to the forefront, having it be our North Star, is to include a mission moment during staff meetings. I know of several health centers that have this, where they offer the opportunity for 1 to 3 employees to sort of say, like, here was my mission moment this week or month or whatever, however the cadence is, of like, here's a time when I really felt like I got to live our mission and I saw our mission in action. It's important too to recognize systemic injustices and the organization's role in addressing them and check in with our staff. This can be really hard, and I don't ever want to pretend that it is just an easy thing to check off, but we are all people who live in this world. And so the things that happen within our world are impacting us. And if we at work have to sort of stuff those down and pretend like they're not impacting us, that can actually cause a lot of stress and burnout, especially when we're working at an organization that says it's mission driven. If then those systemic injustices are being ignored, it can make us feel like there's a real disconnect between what's being said and what's actually being done. Again, continuously communicating the direct connection between the organization's mission and everyone's work. Sometimes in the day-to-day, it gets hard. You stop seeing the connection between how you working in billing is really making sure that this mission happens. But if we're really thoughtful about communicating that, we can keep it at the forefront of people's minds. And then offering or creating a coffee break or a book club, or just sharing resources on an intranet for staff to come together and discuss an article of interest, or have that space and time to be thoughtful about, what's going on in our world and how we can continue to serve our mission. And sharing patient stories, again, bringing it back to why we all do this and who this is really for. Next, we'll talk about compensation and benefits. So it's really important that we have equitable, competitive, effective, and sustainable compensation. And again, I'm not saying that that's easy. Those are 4 things that are hard to all have all at the same time, but it really is a way that can help your health center be competitive. So talking to leadership about ways that you can stay competitive even in a market where you may not have the same resources as say, a local hospital system. We also talk about equitable compensation at the STAR Center. When we talk about it, we want to highlight that this is part of your JEDI practices and that this is a social justice issue. So women, people of color, people with disabilities, and those with other systemically marginalized identities have historically been paid less, which leaves them perpetually disadvantaged within our capitalistic structure. And so think about instead of paying people a living wage, but a thriving wage. And when we're doing that, we are doing justice to remedy these inequities. We do have some thoughts on how to eliminate pay inequities, including conducting regular pay audits, maintaining transparency, stop using salary history as a basis for how we're paying people. Again, when we think about who has been systemically underpaid, if we just base people's salaries on that, we're going to actually continue to perpetuate inequity rather than remedy it. Use those inclusive and fair salary ranges and put them on the job announcement and then stick to it, and understand the importance of pay equity and transparency in your retention and recruitment work, including for different workforce generations. Again, we need to be thoughtful about what matters to millennials and Gen Z, and pay equity is really important to those two generations. Again, we love highlighting resources. You can access this pay equity checklist when you get the slides. And then Mandy can talk a little bit about total compensation statement.
Thank you so much, Helen. Yes, total compensation statements can be a really great way for you to show the total value that your opportunity brings. And when I say the total value, I mean your monetary and your non-monetary items. This can be a really helpful tool when you are extending an offer to a candidate, but it can also be used as a retention tool. So something that you can share with your employees during their annual review process, just to remind all of your staff how much you really value them. It allows you, it's a way for you to show all the direct costs that you have for the employee. Those are the given things that, you already kind of know about: your regular hourly pay, your taxes, bonuses, etc. But then those extra indirect costs as well. So assigning a dollar value amount to all of those unique benefits that you might be offering to really show the full picture of the compensation. It's not just about their take-home pay. There's a lot of other things that you offer as an organization. So showing the value of those can really be beneficial to really show how you compare, how you can be competitive with some of the other opportunities that they might be considering. So again, great tool for retention, but also for extending an offer to a candidate. And there's a link to the guide right there for you to access that. And it gives you also an example of a total compensation statement and how to present that to a candidate or to an employee.
Perfect. Awesome. So along with that, when we're as part of those total compensation statements, we can include things like benefits. And this is another place where, as health centers, we get to be a little bit creative and have that opportunity to think outside the box. And you should include traditional benefits like health, dental, vision insurance, as well as retirement contributions and matches. Those ones are sort of a given, but this is where you might be able to create a stronger compensation package when you maybe can't offer as competitive of a salary. And so as you're doing that, you can think about equity, inclusivity, flexibility, and again, allowing that space for creativity. I won't go through this entire list, but this is again a place where you can review it as you're creating these lists and think about the different ideas that you could include as part of your benefits. And some may be expensive or challenging to implement depending on your situation, but some are surprisingly simple and low cost to implement. And then again, where there are costs, this is all part of that we're spending money to reduce recruitment, which can cost us a lot of money. So thinking about making sure that our health insurance is inclusive, that we are valuing continuing education and career ladders, that we're creating a strong work-life balance organization and what that can look like. And then again, I'll let Mandy talk about some unique benefits.
Yes, certainly. Kind of following in the footsteps of what Helen was just saying, be thinking about what can really showcase you as a destination employer. So all of these things listed here, from culture, camaraderie, mission, safety, strong leadership, these are all things that we've identified that today's candidates prioritize. These are things that are really important to today's workforce. And it doesn't matter which generation. In my next slide, I'm going to talk a little bit about kind of generational preferences or priorities. But for the most part, since the pandemic, people really had a lot of time to focus in on what was important to them. And these were some of the things that were identified. So be thinking through, what can you bring to the table? What can you tout or brag about that's unique? What are the unique benefits within your organization? And there's so many different ways that you can do that. These are just a couple of ideas of things that you could talk about. And then also be thinking about your community as a benefit too, because especially if you're in a rural or underserved community, there's a lot of things that you could, as an FQHC, you could really help your staff really take the time to enjoy the recreational activities that maybe are available in your area. Or maybe you're a nonprofit and you give time off for your employees to volunteer in the community, something that we refer to as community time off, or CTO. Maybe you offer childcare or housing support. We know that people struggle to find available childcare, and it's expensive. So maybe you can, as an organization, work with other organizations in your community to come up with a way to kind of have reserved slots available for your staff for new hires that are coming on. Or maybe you can work out a discount for childcare, or same with housing, working with your local banks to come up with collaboration or initiatives to help new families coming into the community of where they can find housing, whether it's applying for loans or just having housing available. Same with your remote employees, offering discounts on devices or paying for devices that they might be using to work remotely, or offering a stipend for the Comcast or utility plans as well. These are just some ideas. Again, you can include these in your total compensation statement as well, because these bring a lot of value. And we can move to the next slide. This one here talks about the generational priorities. I always like to say, we don't all fit in the same box, but it is really helpful to really kind of understand. We have 4 different generations working in the workforce, and that's a huge span. There's a lot of generational gaps from your boomers all the way down to the Generation Z. So as you think about your retention plan, be thinking about what your staff's priorities are. And these are just some areas to kind of give you an idea of some of the things that are important to the different age and generations, but make sure that you are talking and communicating with every individual employee, because everyone is unique. Everyone has differences. These don't apply, they're broad. They don't apply to every single person. So you want to make sure you understand and talk to each one of your employees about what are your priorities, what's important to you, and try to meet them and provide as much flexibility to make sure that you are matching their goals and meeting their priorities and preferences. But this is just a good starting place to help you kind of realize what's important to each of the different generations, and what types of opportunities they might be looking for, and where they might be looking to grow within the organization. And what's most important about this is that you really show appreciation to all of the team players, no matter the age or what generation they come from, making sure that you're recognizing the value that every generation brings, and then making sure you're doing activities as a whole within the organization to help strengthen the bonds between and across the different generations, whether it's doing a reverse I just lost the term, like a reverse training, where as opposed to having the your experienced or your novice employees training the new hires, maybe your younger generation or your new hires could do a training for some of the older generations, whether it's EHR training or maybe utilizing apps to streamline processes in your organization. But kind of thinking about ways that you can team build and create some of that team building skills with across the generations is going to be really helpful in strengthening your retention plan. And I'll turn it back over to Helen from there.
Yeah. Yeah, I think this is so beautifully laid out, and I love the piece of thinking about that element of like 4 different fairly distinct groups. And like you said, no group is a monolith, but thinking about how we can help these groups work together is really important. So thank you for
Yeah.
highlighting that. So that is the end of our content for today. I know that we went over a lot. We're trying to jam a lot of information into 2 webinars, but we wanted to make sure that we covered everything so that as you're doing your retention planning, you have a lot to think about. So I haven't seen any questions in the chat yet, but feel free to pop them in there as you think of them, and I'll go over some more, again, sort of like closing logistics as folks think of that. We do have several upcoming events, which is great. We have a webinar series on diversifying the health center workforce. That will take place a week from today and June 5th. And then, of course, the second part of this webinar series on June 12th. And then we have our workforce training and technical assistance professional development series. And we have had all but one of those sessions, but the final one will take place on June 18th, which is exciting. And those are always pretty good. The final one was sort of every session we had a live vote on what the final session would be about. So it was chosen by attendees, which is always nice. Of course, the STAR Center has tons of resources, always changing, always growing. We have opportunities to learn on your own time through self-paced courses, YouTube videos, and podcasts. And then we have a conference coming up at the beginning of August in Washington, D.C. And I know Mandy has a learning opportunity available as well to highlight.
Yes, I wanted to make sure everyone knew about our annual academy. The 3RNet provides a 6-part webinar series every fall. The 6 webinars run once a month from October through December. We do have a website. I have a link to our academy website here where you can learn more about. And this year's theme is going to be on retention. So it will really kind of emphasize what Helen and I are sharing with all of you in this 2-part series. But our webinar series is on retention tools, data, and stories. So I hope you will register and we'll see you there.
Nice. And then finally, you can always get in touch with us. I'm still not seeing any questions in the chat. So before we finalize and give you all a few moments of your day back, we will be launching a evaluation. It should just pop up on your screen. If it doesn't, please do let us know. We really appreciate when folks fill this out. It means a lot to us. It helps us continue to get better and serve you as best we can. We will share the results with our partner organization, 3RNet. And of course, HRSA, as you all know, HRSA likes evaluation data. So we ask that you give us your feedback. And we'll say once you've submitted your evaluation, that can sort of be your ticket to leave us today. But thank you all again so much for being here. It was wonderful hanging with folks, and we'll see you again, not next week, but the week after for this webinar series. Of course, maybe I'll see you next week for a different webinar series because there's always something else going on. But thank you to our audience, and thank you, Mandy, so much for sharing your incredible wisdom. It's always such a delight.
Thanks for having me. It was a pleasure.